Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armond Budish and Board of Health Medical Director Dr. Heidi Gullett. We will begin by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Hello, everybody. Board of Health Commissioner Terry Allen is not here today, but another one of the public health superstars, Dr. Heidi Gullet, is. Heidi, thanks for joining me today, and thank you for all you do for the residents of Cuyahoga County. With COVID, the holiday season was a hard time for all of us. Family and friends got sick. We were forced to stay indoors. It was tough. But now, as we look ahead to spring and the snow starts to melt, I'm feeling optimistic about where the county is with our COVID numbers. We continue to see fewer COVID cases and hospitalizations. Our numbers are the lowest they've been in quite some time. I'm sure that Dr. Gullett will talk about this more. The CDC has adjusted their masking guidelines for indoor spaces. They're using new community-level metrics. Their metrics classify Cuyahoga County to be at a medium level. With that classification, masks are no longer required in indoor spaces. So I today signed an executive order, I have it right here, lifting the mask mandate in our county buildings in most circumstances. It doesn't mean that COVID is gone by any means, and it doesn't mean the danger is over, but it makes mask wearing voluntary. One of the biggest repercussions from the pandemic has been that many people lost jobs and couldn't pay their rent. Already, we've spent $25 million to help roughly 3,600 households to avoid eviction, and we're in the process of allocating another $25 million. And now for the big news. Working with the state of Ohio, we just obtained another $50 million for rental protections. This is very exciting. This brings our grand total of funding to over $100 million in rental assistance and wraparound supports to county residents adversely affected by the pandemic. These funds stand to make a huge difference in financial stability for a lot of renters. I want to thank the state for this additional allotment. They know we'll put it to good use. Switching gears now. Tax season's here. This is bad news for some of you, but for others, it can actually be good news. Thanks to the Earned Income Tax Credit called EITC. That's right, if you made less than $58,000 last year, this credit can reduce the amount of your taxes. And even if you don't owe or pay any income tax, you may get up to about $6,700. But you'll have to file a tax return. To schedule a free appointment with the EITC Coalition, call 216-293-7200 or go online at refundohio.org. They'll tell you if you qualify, and they can even file your tax return for you. Now, before I turn it over to Dr. Gullett, I have to end on a somber note. Over the last week, we've seen the devastating invasion of Ukraine by Russian military forces. These attacks have resulted in the loss of innocent lives and the displacement of many, many people. This vicious attack affects all of us. On a broad scale, this is a devastating attack on a sovereign, democratic country. Locally, the city of Parma, which is home to over 42,000 Ukrainians, and Northeast Ohio as a whole, have one of the highest populations of Ukrainians in the country. We feel like we want to do something. We want to help. But what can we do thousands of miles away? For one, we can make a donation. The Fund to Aid Ukraine is a local organization that's been around for over 30 years and provides funding, medical aid, and supplies to those in need. You can donate to this nonprofit group at fundforukraine.org. Your donation makes a difference. Look out for further information and resources on our social media pages at Cuyahoga County. Some of the Ukrainian churches in Parma are hosting prayer services and serving as donation sites. Cleveland-based nonprofit Brook of Hope, founded in 2017 by Ukrainian immigrants, is asking for donations like clothing and non-perishables being collected at Bethany Assembly of God in Parma. The information's on your screen. We're grateful for local organizations like these who are making a direct impact. Stay informed about the conflict and be cautious about information spread on social media. We must stand together in support of democracy. If we don't stand together, we fall apart. Yesterday, we raised the Ukrainian flag in front of our county administration building to show our support. Our hearts are with all Ukrainians during this very difficult time. Thank you all. And with that, I'll turn it over to Dr. Gullet.
Thank you very much, County Executive Budish. I'm grateful to be with you today and appreciate all the support you continue to give us on the public health side of the work we do here in the county. I also want to echo your comments about Ukraine and just ensure that folks know the public health and health-related impacts of war on top of the other traumatic events that we've been seeing unfold throughout the country, throughout the world, and in Ukraine. So thank you for giving us opportunities for places that we can act locally. And thank you for giving us an opportunity to take a few moments today to declare that we stand with Ukraine and we want to support our local Ukrainian neighbors and all of those throughout the world who are impacted by this devastating invasion. I'm also here now with some really important news, exciting news that we are showing our data continue to improve for COVID-19. We are thrilled about this, as I'm sure many of you are as well. We've all been hoping for the day where we see continued decline of our cases and continued decline of hospitalizations, and where our hospitals have access to treat all of the other conditions that we need to be available for, all the other acute issues and surgeries and all the other things that we need to do to help people stay healthy. So we're seeing improvement in all of our metrics here in Cuyahoga County, and that has been sustained improvement for a number of weeks. In particular, our percent positivity, which is the percent of cases of people tested for COVID that returned positive, have been very high, in particular in the end of December and early January. And we are now down under 3%, which is excellent news. Our cases per 100,000, which is the population metric that we often look at to determine how much community spread is happening, is also much lower, as you heard our county executive mention earlier. We're in the moderate transmission, according to the CDC updated guidance of how they look at the level of transmission in a community. So these are all excellent things for us to see. COVID is not going away. It's not leaving, but we certainly see that we've moved out of this very difficult time we had over the last few months, not to mention the last few years, but the last few months have been very, very difficult, and the highest level of cases that we've seen, of course, throughout the entire pandemic. A real stretch on our healthcare system, and that's now beginning to recede tremendously, and that's really encouraging. But I also want to say that we have about 68% of our community here in Cuyahoga County that is considered fully vaccinated, those first 2 doses, and those are ages 5 and up. But we also know that we have a much lower percent of individuals, around 34% in our county, that have gotten the additional booster dose of the vaccine. And there are a lot of reasons for that. But I just want to leave people today with a reminder that while COVID isn't going away, we're learning about what our new normal looks like. We all want to return to that in-person connection that we crave, the shared humanity that is so much easier to find joy in person. We love that. We want to have our lives back, enjoying the things we always have. But we still have to remain vigilant, particularly if we don't have a high number of people who've had a booster vaccination. And we still have nearly a little over a third of our population that hasn't had any vaccine. And those under 5 still cannot be vaccinated yet. We're hoping that that will be soon, but we're still waiting for final decisions on that. So it's important that we remember the people who haven't been vaccinated and who cannot be vaccinated, and we protect them. So even though we now can ease up a little bit on some of the what we call mitigation measures that we've used over these last couple years, it is still perfectly acceptable to wear a mask, particularly if you work in healthcare. That's very important. We still see acute cases of COVID, and we don't want to spread within a healthcare facility. It's also really important to think about the own impact in your own family and the people that you live with or that you interact with. So if you yourself have a condition that make you at real risk, or you have a reason you couldn't get vaccinated, you probably want to consider continuing to mask, at least at this particular time. And that is perfectly acceptable. There is no stigma with that. And we strongly encourage you to do whatever you need to do to protect you and your family and those around you. The last thing I'll mention is that we have seen a drop off in the number of individuals looking for vaccination, seeking out our regular vaccination events. And that's the same for many of our clinical partners around the community. But we will continue to offer vaccinations. It's critically important, and we'll probably see from time to time, we see infection numbers rise. And our best protection against that is vaccination. So we would encourage everyone who has already received their full first series and has not been received a booster to please consider doing so. That is really the way to protect yourself going forward. And we would encourage anyone who hasn't gotten either a first or second dose to complete the first series to really consider that. I've had a number of conversations with patients even this past week and have given some first dose vaccines. So it's not too late, and we encourage you to do that, because it is your best defense as this moves to really something that's circulating on a lower level in our community, which is excellent, but yet it's still here, and there's still risk associated with the disease if you don't have immunity. Finally, I would like to take the moment of gratitude, which I usually share during the times I join these press conferences and have for the last 2 years, to thank our Cuyahoga County Health Commissioner, Terry Allen. Terry has been leading our agency for a very long time and will be retiring in April. And we haven't really had a chance on one of these press conferences to thank him for his leadership. And while he's not here with us in person today, we can have him watch it later. But I just wanted to publicly thank him for his leadership. This has been a really tough time. And not only has he been our leader through the biggest challenge in our public health careers, but he's been the leader of our health department for many years, walking us through lots of other crises before this and maintaining a very strong and steady leadership, and always focusing on everyone in this community, no one being left behind and everyone receiving opportunity for their highest level of health. And so that was true in COVID, but long before COVID as well. So we wish Terry all the best, and certainly there'll be some celebrations to come in the coming weeks, but I wanted to just take this moment to thank him publicly, as he is humble and doesn't always want us to make a big deal, but I thought this was an appropriate time. So with that, I will turn it back over to Devin for any questions. Thank you very much for your time today.
Thank you both for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to please stay muted when not speaking. So with that, we can take a question. Going once, going twice.
Hey, it's Caitlin with Cleveland.com.
Hello, go ahead.
Hey, this question is for Executive Budish. If we are no longer having a mask mandate in place, are you still considering vaccine or testing mandates for county employees at this point?
Not at this point. Clearly, the CDC has changed its evaluations for the good. I mean, that's a really good thing. We've always followed the CDC guidelines throughout this pandemic based on the science. And as the CDC guidelines and the science changes, we change our position to fit.
Thank you. Any other questions? All right. Well, thank you very much. That concludes this week's briefing. Thank you so much for joining us, and we will see you in a few weeks. Have a great day.